歡迎大家。
Welcome to today's press briefing. We have with us two speakers. They are from the Center for Health Protection Communicable Disease Branch, Principal Medical and Health Officer and Dr. Albert Au, as well as the Hospital Authority Chief Manager Dr. Lau Ka-hin. The two doctors will give us update on COVID cases as well as the Hospital Authority. Dr. Lau, I'll give you an update about the HA. We have 1,995 confirmed patients staying in hospitals. 300 of them are new cases. Those staying in isolation facilities, there are 524 in isolation wards, 170 in second-tier isolation wards, 614 in North Lantau, Hong Kong Infection Control Center. There are 237 new cases. Yesterday, we have reported 8 patients in a critical condition. 8 patients in a serious condition. For those staying in hospital, there are 43 critical cases and 30 serious cases. 11 critical cases are in ICU receiving treatment. On death cases, we have reported 3 new death cases. 3 are males aged between 65 and 81. For the 3 male patients, they all stay at home. All 3 of them have no record of any vaccination. We have been repeatedly appealing to the public that vaccination is very effective against serious cases or death cases upon contraction of COVID-19. For today's 3 death cases, they have not received any vaccination. If you have been vaccinated, when you have not been vaccinated, death rate is, the chance of death is 60 times more than those who have been vaccinated. If you are chronically ill, if you're elderly, if you have not been vaccinated at all, please get vaccinated. If you have received 1 or 2 doses, please get your 3rd and your 4th doses. I'll give you details about the 3 death cases. The first one is a male, 66 years old, unvaccinated. He suffered from lung cancer. It has spread to his lymph node as well as his brain. He's on chemotherapy, also a carrier of hepatitis B. On the 26th of July, he went to the A&E department of United Christian Hospital. He's been suffering from a fever for a week. He had phlegms, he had coughs, and difficulty in breathing. At that time, the PCR CT value was 19 or 20. Lung X-ray showed that on the right side, there is full opacity. So he's been staying in the medical ward. He's been receiving remdesivir. On the 29th of July, his CT value was 33. That was the 9th of August. And his condition was stable. He was not suffering from a fever. However, on the 13th of August, his cough came back. There was phlegm, and he was a bit delirious. He was sent to the A&E at Prince of Wales Hospital. We have conducted some checks and found that there was some problem with his lungs. He was sent to hospital for admission, and his CT value was 31 at that time, which is on the low side because of his lung cancer and also his lung condition, which is related to his lung cancer. He passed away yesterday. For this patient, he suffered from a pleural effusion. When he went to the A&E department, he was prescribed with remdesivir. His condition was stable. So we appeal to the public, if you are asymptomatic, if you're over 60, if you are COVID positive, please see a doctor and ask for prescription of medication. This will reduce the risk of a serious condition or death. For this case, his death is very much related to lung cancer. The other case is a 65-year-old male, unvaccinated. He suffered from hepatitis. He was at one point on chemotherapy because of cancer. But that was a decade ago. On the 16th of August, he had difficulty breathing starting from the 10th of August. About 3 or 4 days ago, on the 16th, he was sent to the A&E department in the Cheongkwano Hospital because of loss of appetite, and his condition deteriorated. At that time, the RAT was positive. The PCR CT value was about 19 to 20. He was sent to the medical ward, and he was prescribed with remdesivir, and he passed away on the 20th of August. Apart from hepatitis, he did not suffer from too many illnesses. Well, what I'd like to say is vaccination. For this patient, 65 years old, he has been unvaccinated. So the risk of his condition becoming serious or ending in death is very high. He couldn't breathe for about a week, and for the past 3 or 4 days, there was serious loss of appetite. But he only went to the A&E department at a rather late stage. We understand that is not an elderly case. And if you are 65, if you've been to a designated clinic, you will be prescribed with COVID medication. For those who are not considered old, and if they suffer from loss of appetite or shortness of breath, they might not think it is anything serious. But if you go to see a doctor, you will get proper treatment. The last case is an 81-year-old male, unvaccinated. For this case, he suffered from a number of chronic illnesses, coronary disease, impaired kidney functions, enlarged prostate glands, and lung cancer that has spread to his bones. He's been receiving immunity treatment. On the 29th of July, he suffered from difficulty in breathing for a few days. He was sent to A&E department. We did an X-ray and found that the right side of the lung was opaque. His RAT was positive, and the PCR value was 16. He was admitted to oncology department. He had a fever. He was prescribed with oral medication, but there were other problems. That is, the coronary disease causing myocardial infarction, and his viral load continued to climb. But because of other medical condition, namely his myocardial infarction and lung cancer, he passed away yesterday. For this case, we understand that he was getting on and he suffered from lung cancer, but that is not the reason not to get vaccinated. So far, we have not seen any other information in his record. When you are on immunity treatment, it's not a reason not to get vaccinated. But if you suffer from difficulty in breathing, please go see a doctor as soon as possible.
And let me turn now to recovery. 203 have recovered, 169 have been discharged yesterday. 10 were picked up during admission screening. 17 are listed as close contacts. For staff members, 74 more tested COVID positive, and 11 have returned to their posts. Dr. Al. Thanks very much. I'm Dr. Al. Yesterday, 20th of August, I'd like to bring you up to date on the situation. Yesterday, locally infected cases, 6276, 2239 picked up through PCR, and 4837 RAT verified by PCR. 237 imported cases yesterday, 196 through PCR, 41 through RAT. As Dr. Lau said a moment ago, there are 3 deceased cases since the 5th wave, cumulatively 9,392 fatalities so far. Of these 9,392 cases, those between 60 and 79, they take up 25% of these patients. 81% never had any injection or had one shot. Those above the age of 80, they take up 71% of the overall fatality. Of these, 89% of the cases never had any shot or had one. Of the 237 imported cases, 114 were picked up at the airport temporary specimen collection center, and 65 were picked up at the quarantine hotels or quarantine centers. The remaining 58 were picked up at the CTCs. 49 were picked up from days 4 to 7, and the remaining 9 were picked up beyond day 7. Now, for these 9 cases, CT value is more than 30, more likely repositive cases. The imported cases come from 44 countries, and 7 had more than 10, 39 from India, 31 from the UK, 20 from Thailand, the US 22, Canada 13, and Singapore 12. The remaining 37 countries have imported 10 or less than 10 cases. For care homes, there are 6 care homes with new positive cases, 3 RCHEs involving a total of 3 residents and 1 staff member. And there are 3 RCHDs involving 4 residents. For these 6 care homes, there are 29 residents who are listed as close contacts. They are subject to quarantine. The first one is in Kwai Chung, Ong Fuk Care Home. There is 1 resident testing positive. The second one, Yan Wing Care Home in Kwun Tong, 1 resident and 1 staff member testing positive. The third one in Eastern District, Keon Yun Care Home, 1 resident testing positive. There are 3 RCHDs in Tuen Mun, a New Life Rehabilitation Center. RCHD, there's 1 resident who tested positive. Tuen Mun New Life Rehabilitation Center, Jockey Club Long Se, 2 residents testing positive. And the Southern District, TWGH, Jockey Club Jin Kan Day Care Center, 1 resident testing positive. I'd like to update the situation with regard to 1 care home. We have evacuated the residents there to the AWE, and there are more cases during the quarantine. And this one is in Sai Kung, Jiangnanshu Fuk Yun Care Home. There are 27 residents and 5 staff members. There are 3 stories there. On August 14th, we got notified that 1 carer and 1 resident tested RAT positive on August 12th and 13th, and the residents in the same room are listed as close contacts. In August 16 and 17, through the PCR test, we have picked up 2 more residents who tested PCR positive. On August 18th, there are 2 staff members who came down with COVID as well. Yesterday, we've arranged all the residents to be evacuated to the AWE. Now, for those who are listed as close contacts, some displayed symptoms at AWE and they were sent to hospital, and there are 13 residents there. In this cluster, this center has 16 residents and 3 staff members who test positive. Now, through genome sequencing, they are L452R, probably BA.5 subvariant. Over the past 7 days, 48 care homes reported cases, 32 RCHDs and 16 RCHDs, involving 95 cases, 73 staff residents, and 22 staff members. Over the past week, we have found that there are some cluster outbreaks in some of the care homes. In these care homes, we saw that there are more than 1 staff member who got infected, and mostly the staff members came down with COVID first. We urge the staff members of the care homes to undergo RAT daily and also to undergo a PCR. And it's only when they are negative that they should turn up for work. They should not turn up for work if they have symptoms. Even if they test RAT negative, they shouldn't turn up for work. Today, being school holiday, yesterday we received some new cases from the school. In one of the classes, there is a cluster. We advise that this class be suspended. And this is on the islands, the Taiyangdo Kindergarten, K1C. There were 21 pupils. 3 pupils came down with COVID over the past 3 days. We advise this be suspended. For subvariants, yesterday, the pH lab conducted the tests, which showed that those carrying L452R, presumably BA5, the percentage has increased to 34.2. Yesterday, it was 30.2. We've seen an increase there. At BA.2, 0.12, 0.1 yesterday, the percentage stood at 8.5%. Today is more or less the same as yesterday. It's now time for question. Please identify the organization you represent and wait for the mic to come to you. Any questions there, please? The last row in the middle, the lady in black. Now TV. Dr. Lau, you mentioned the 3 deceased patients. They all experienced shortness of breath, and they never sought medical attention. Isn't it right that they should have sought medical attention if they experienced any shortness of breath, or would you advise them to observe the condition for a couple of days? Now, for AWE, on August 18th, some residents were evacuated there. Is the case AWE has been sprung into action? There are 200 beds that are said to be operational. Are they operational this week, or is there sufficient manpower to deal with the situation? And in Jianglanshi, presumably it was a staff member who started the transmission. Now, the staff members have to undergo RAT daily, and they have to undergo PCR tests. Do you think that these tests are anywhere sufficient? How can they protect themselves as well as their charge? Right, let me take the question first about the Fook Court Nursing Center in Jianglanshi, Saikong. On August 20th, we have evacuated the residents to the AWE testing quarantine center. Now, there is a quarantine center run by the SWD, and they would admit the close contacts who are from the RCHDs or RCHEs. If they are listed as close contacts, they will be sent there. Now, this is a quarantine center at AWE, and they will be administered PCR tests. We will monitor the situation. In this center, one of the staff members, a carer who got tested positive, she would wear the face mask at work. Last day at work was 11th of August, and she left the center on August the 12th, and the RAT test came back positive. And thereafter, we arranged for all the residents and staff members that they go a PCR test, and then we picked up more cases thereafter.
Well, these cases appear between the 16th and the 18th of August. We have conducted some analysis in view of recent outbreaks. Very often, we see that for the first case is more often than not a staff member, and it's an RAT positive result. However, because of the low sensitivity of RAT, if it is someone who is asymptomatic, probably before the RAT turned positive, that person was already contagious. As a result, the staff member would transmit the illness to others, causing an outbreak. The most effective preventive measure is for staff members to conduct RAT as well as regular PCR tests. This is to identify asymptomatic cases as soon as possible. If staff members have symptoms, please go see a doctor, get tested, especially PCR tests. This is to identify hidden cases and stop them from entering the care homes. If you suffer from any discomfort, including shortness of breath, dry throat, runny nose, lethargy, these are not special symptoms, but you can always do an RAT first to see if you have got COVID, or you get the deep throat saliva vial to get tested. You can also go to see a doctor as soon as possible. The doctors will prescribe the right medicine for you. For 2 of the 3 cases, they have lung cancer, and a usual symptom for lung cancer is shortness of breath. They might think that is part of their lung cancer problem, so they did not think anything about it. So for patients who suffer from pulmonary obstruction or pulmonary diseases, if they see that the shortness of breath got more serious, if they develop a fever, if they see that they have lost their appetite or have a fever, these may be early onset symptoms of COVID. Please see a doctor as soon as possible. As you can see, that problems in the lungs is one of the risk factors causing a serious condition or death. For the AWE, we will commission halls 8 and 10. There are still 6 halls that are operated by the Social Welfare Department. These halls are used as quarantine centers for care homes for the elderly, or care homes for people with disability, or those for close contacts. For halls 8 and 10, they are used as community isolation facilities for people who have contracted COVID-19 and are receiving treatment in a community facility. These halls will be commissioned in the coming few days. We have everything ready, including manpower. All staff members know when they will have to go to these facilities to work. And so they know that in a few days they will have to go and work at these centers. Between the 16th and there are about 200 or 300 of such staff members. For patients that require a low level of oxygen supply or other medical requirements, they can receive treatments there because we have a team of physiotherapists, Chinese medicine practitioners, and relevant allied health professionals there to take care of patients. This will release some beds for more serious cases. Any other questions? The gentleman at the back. I'm from AM730. Just now you mentioned about the nursing center at Chenglanshu. Can you give us more information? What is the distribution of the positive cases over the 3 floors? Information about close contacts, please. You said that for recent outbreaks, the first case usually were staff members. Do you think that in the 5th wave, is there sufficient protection in care homes for residents? And you mentioned about 200 beds at AWE. Previously, you said that they were for patients of a younger age. So apart from those who are clinically stable, would you consider their age before you put them there? Your question about the nursing center at Chenglanshu. The case we identified first was from a care worker. It's a nursing home of a small scale with only 27 residents. There are 3 floors, ground floor to the 2nd floor. So there would be close contacts between residents and the care workers, say for example change of their diapers or feeding, but they all wear their masks. On the 14th of August, we received information about a RAT positive case of a resident who stayed on the 1st floor, but there are other cases on the ground floor or other floors. We also hear about positive cases of staff members, and they've been verified by PCR tests. For this nursing home, the 3 staff members will stay at the care home. They are live-in staff members. That may be the reason of transmission amongst staff members. And as a result, further transmission to residents. For care homes, for the elderly, or care homes for people with disabilities, we see an increasing number of cases. That's expected because with an increasing number of cases in the community, it's inevitable that there will be more cases in care homes. But compared to the 5th wave back in February and March, the situation in care homes have greatly improved. So we think that, we know that vaccination rate amongst residents as well as staff members for these homes have been increased. This is proper protection for both residents and staff homes. As a result of this, the asymptomatic cases accounts for more cases, and the number of deaths has dropped because of vaccination. Even with an outbreak, the patients will not end up in ICU or end up dead. So the situation is alleviated compared to what happened before. Everyday staff members are tested using RAT, even though the sensitivity of RAT is lower. but it's still an effective tool to identify positive cases early and to stop further transmission of COVID in care homes. We have sufficient quarantine and isolation facilities, so the situation is different from that in February and March. Back then, a lot of the positive cases have to be quarantined or isolated in situ, that is, in these care homes, which are not suitable facilities for isolation or quarantine. So our measure was that the first case will have to be quickly removed from the facilities, and those who are close contacts are moved to the AWE.
For AWE, at the very beginning, we admitted people with ability to look after themselves. They don't have any mobility problems because the hospitals were reserved for the elderly population. But we had more community isolation facilities. Many don't have to go to AWE, or some would serve quarantine at home or isolation at home. And the patients for treatment were mainly elderly people. As I said earlier, well over 80% of the COVID patients hospitalized are over 60 years of age. So at AWE, we would very much like to provide a suitable treatment for the patients. Mainly, they are senior citizens. So the patients for treatment are mostly senior citizens. So we are opening 200 beds now. And I mean, we have more manpower compared with the previous situation where we had to open 300-400. And the senior citizens or senior patients would need more manpower than other patients. Next, please. The last but one row, the lady over there.
From VTV News. So a question about the outbreak in the Saigon care home. You said it was sparked by a staff infection. And does that mean the current measures such as daily RAT testing are not enough? And what are the transmissions, how the virus transmit in the care home? And what does the hospital authority advise people who show symptoms of COVID, especially those who have difficulty breathing? Thank you.
Thank you for your question. For the first question about the outbreak in the 福苑護老中心 in Saigon, the first case involved personal care workers who might have direct face-to-face contact with residents. She was tested positive by our AT on the 12th of August, and subsequently, upon PCR screening among the residents and also other staff in this RCHE, we identified more cases involving staff, and we found that the staff they actually lived in the same hostel. That this might be the reason causing the spread among the staff, and also we noticed that there were residents on different floors of this RCHE, so that means there is transmission among from the staff to the residents. So the most important thing is that staff they must do RAT, because there is increased transmission in the community, and our CHE or our CHD staff, they are living in the community, so they have an increased risk of getting infected. But the main point is we need to prevent the virus from going into the residential care homes. So it is very important for staff to maintain vigilance, and they should do RAT every day. And also, if they have symptoms, they must not go to work and do a PCR. And they are also encouraged to do regular PCR tests in order to identify early infection, which might not be picked up by RAT.
Actually, the symptoms of early COVID can be very mild or can be very non-specific. The patient may only complain feeling of tidiness or decreased appetite. Sometimes the patient may have also complained about some low-grade fever, running nose, sore throat, or some difficulty in breathing. So no matter how mild the symptoms is, please go to have a test, a rapid test to test whether you are having contact the COVID virus, or you can do a PCR by deep flow saliva. Sometimes when the symptoms persist, even if the tests are negative, you should also go to see the doctor, because sometimes there may be other causes for these kinds of symptoms, and the doctors may help to make the diagnosis and give proper and appropriate treatment. If you have a positive RAT or positive PCR, please go to see the doctor in the designated clinic, or sometimes can go to the doctor with a private doctor with antivirals treatment, or you can have a consultation through the teleconsultation by making an appointment with our HA Go, or by the hotline, our HA hotline, so that you can make an appointment. The antivirals can be delivered to your home after you have the teleconsultations if the doctors think you need to take the medication. The hotline of HA is 1-833-6115. Okay, thank you.
下一位，左手邊最後嗰行呢個男士。
A gentleman at the back, please. Ming Pao Daily. Dr. Ao, about the Fook Court Nursing Centre, is the first centre with a BA.5. What is the vaccine coverage? What is the proportion of serious cases? When was the last case that happened? The evacuation took place on the 18th of August. Why does it take it today to make the announcement? Dr. Lau, the reopening of the AWE, some senior citizens have been admitted. Is the reopening of AWE intended to triage the patients, or is it intended to admit more patients? And also the holding centres, and it is that some senior citizens will be referred to the holding centres. What is the mechanism like? How do you assess the situation? Will the senior citizens be allowed to make the request to be sent there? Yes, thank you for your question about the Fook Court Nursing Centre. On August 24th, we became aware, August 14th rather, we became aware of the situation. A resident and a staff member got infected, and we've arranged, we have listed the residents as close contacts. Now, there were isolated cases, so we didn't evacuate the entire center, and subsequently we required the staff members to undergo PCR, and the residents had to be screened, and we picked up more cases through PCR. On August 18th, we decided to evacuate the entire nursing center, and they were sent to the AWE. Now, when the close contacts were sent to the AWE, they will be administered PCR test, and for those with symptoms, they would be sent to the hospital for further testing, and we picked up more cases there. Now, for this cluster, I mean, this is not the first care home that reported BA.5 in the community. 35% of the cases are probably BA.5 with L452R. So in the care homes, we think that there are similar situations there. In the care homes, the cases probably would first start with the staff members, and 30% of the cases are actually BA.5 in the community. So this is a similar situation in the care homes. Now, in this nursing center, 81% with one shot, 78% with two shots, and only 70% with three shots. The reopening the treatment center at AWE is because there is a surge in the number of COVID-positive cases in the community, and we anticipate that the number of patients, not least senior citizens who need hospitalization, would increase. As I said, we're admitting more than 100 senior citizens who are COVID positive patients. If the number goes up, we need to have extra beds for us to admit these senior citizens. An AWE treatment center is actually serving this purpose.
喺任何情況，
Of course, we try to reduce the impact on hospital non-essential services. If we commission beds, say 200 beds or so at AWE, that means the beds at cluster hospitals don't have to be used for COVID patients. We have more patients staying at hospital, and at the same time we need to mobilize manpower and divert it to the AWE. Of course, hospital services will be affected. I ask for your understanding. In relation to holding centers, holding centers run by SWD are one in Siu Sai Wan Sports Center and the other one in Shek Mei. Those staying in these holding centers are from care homes. For the Siu Sai Wan one is residents in care homes for PWDs, and Shek Mei one, they receive patients from care homes for the elderly. For those who are confirmed cases and they need care, they will be kept at holding centers before they are sent back to care homes. We see the number of people staying at holding centers increasing. As at 9 p.m. yesterday, we see the 130 elderly people staying at the holding center at Shek Mei. There are only 180 places at the holding center. So by about Thursday, there will be another one being commissioned in Tin Shui Wai. The role of the hospital authority is to identify private organizations, say private hospitals, to provide medical support at these holding centers. We have approached Glen Neely Hospital to provide support at the holding center at Tin Shui Wai Sports Center. For the type of patients that will be sent there, they are confirmed patients who are asymptomatic or with mild symptoms in a stable condition and no longer require hospital treatment. We have a team of carers, nurses and doctors stationed there to provide required services. The other type is that if they are positive cases in the community, but they need some kind of care, their condition is not as so serious that they need to be admitted into hospital or the North Lantau Infection Control Center, they may be sent to holding centers. The other category is cases referred to holding centers by hospitals. There may be a few reasons. First, they have received treatment at hospitals and their symptoms have greatly been alleviated, but the RAT test is still positive. Or if it's someone who is supposed to go back to care homes, the CT value is higher than 30. So if the CT value is higher than 30, if the CT value is lower than 30, and even with the RAT is negative, they will be staying at holding center until the CT value exceeds 30. For people who are staying at home or care homes, but they don't have people, say, at home to take care of them. Say, for example, the family have all been COVID positive. Then they will be staying at holding centers until there are people at home to take care of them. And for those staying at care homes, maybe no staff members is available to take care of them because they're all quarantined. So they will be staying at holding centers until there are staff members available to take care of them at care homes. So there are different types of patients that will be staying at holding centers. That's why the Social Welfare Department will commission another holding center at Tin Shui Wai. Questions from the last reporter, the one on the right. I'm from Cable TV. First, for care home cases, it might be transmitted from staff members to residents. What are the enhancement measures? You suggested PCR tests. What is the interval? Do you require more vigorous measures? Say, for example, requiring staff members to do PCR weekly to protect residents in care homes for the elderly. My second question. After quarantine at hotels for 3 days, we see that there are more and more cases identified in the community after they have left the hotels. Do you think that there will be more cases being picked up when they are under medical surveillance after they have left the quarantine hotel? In relation to staff members working at care homes, the nature of their work is to take care of vulnerable people, those who suffer from cancer, other chronic illnesses, or who are frail and elderly. So if these residents contract COVID, the risk of a serious condition is much higher than other people. So care homes is an important area that we need to work on. Starting from April, we require staff members to do an RAT every day before they go to work. There is also another requirement under which staff members will have to do a PCR every week. RAT is of a lower sensitivity compared to PCR. So for early cases, they may not be picked up by RAT. We see cases that are picked up from PCR when their RAT test is still negative. For these staff members, if they have an RAT negative result, they may go to work, which is a risk to care homes. But for PCR tests, they have to do it at community testing centers, and the result is not readily available. So we ask care homes to use RAT as a supplementary tool to stop cases from entering care homes on top of PCR tests. We encourage staff members to do PCR tests regularly. We understand that the Health Bureau, together with Social Welfare Department, as well as care homes for elderly and those for people with disabilities, to see if there is any room to increase the frequency of PCR tests. Your second question is about imported cases. After the new measures have been implemented, we only have data for about a week. The number of cases changes every day. What we observe so far is not that much different from before these new measures were implemented. Say, for example, positive cases identified between the 4th and the 7th day, 49 cases, which accounts for about 20% of the overall number of imported cases. Previously, it was around 20% or so that are identified after the 3rd day. That is within our expectation. For these cases, well, when they enter the community, they are subject to some kind of restrictions in the form of an amber code. They are stopped from entering high-risk premises or from engaging in mask-off activities. On top of that, they still have to do RAT test, and on the 4th, 6th, and 9th day PCR tests. That's the end of today's press briefing. Thank you.